Welcome to Nurse Lounge Café, the place where nursing stories, real-life lessons, and professional truth come with a strong cup of honesty. This isn't a glossy, sugar-coated version of healthcare. This is the behind-the-scenes world, the courage, the pressure, the people, and the systems nurses have had to navigate across time. Here at Nurse Lounge Café, we share nursing history you were never properly taught, practical insight that makes you sharper in practice, and the human stories that remind us what this profession has always been about: care, dignity, and backbone. Today, you're going to hear from Annie, a nurse working in 1950s America. And Annie is about to take you into one of the hardest truths of that era: segregated hospitals, and the reality of the colored ward. She's going to describe what it looked like behind the spotless floors and polished corridors, how care was divided, how resources were withheld, and how nurses had to fight quietly, relentlessly, just to make sure patients were treated like human beings. This is not told for shock value. It's told because nursing history is real history, and understanding it makes us better, braver, and clearer today. So settle in. This is Annie's story, the colored ward. Rules of all, the ones nobody wrote down because they were everywhere. Which entrance a patient used, which hallway they were allowed to be wheeled down, which waiting room their family could sit in, which ward they were sent to regardless of their condition. I learned quickly that segregation didn't just separate people, it separated care. The colored ward was smaller, older, hotter in the summer and colder in the winter. Supplies arrived late or not at all. Linens were thinner. Equipment was worn down. Sometimes we had to improvise with what should have been replaced years earlier. And you can call that logistics if you want. But I'll tell you what it really was. It was policy dressed up as practicality. It was discrimination disguised as routine. One morning, an ambulance brought in a man, middle-aged, badly injured from a job site accident. Blood through his shirt, breath shallow, his eyes glassy, fighting to stay open. For a moment, the emergency room did what emergencies always do. It made everyone equal under panic. Hands moved fast. Voices sharpened. We worked on instinct. Then someone looked at his paperwork. Then someone looked at his skin, and the temperature of the room changed. A doctor I'd seen laugh at a nurse's overreaction snapped, "Transfer him." Not to the closest bed, not to the best equipped space, not to where he'd survive with the best odds. Transfer him to the colored ward. I stood there holding gauze, feeling something in me go cold, because I knew what that meant. More distance between him and help, more time, more risk, and the cruelest part, everyone acted like it was how things were. That's the sickness people don't talk about, the way injustice becomes furniture, the way people step around it daily until they forget it can be moved. I helped wheel him down the hallway. His breathing was ragged. His hand twitched like he was trying to signal something, like his body knew it was being moved away from the best chance he had. I leaned close and said quietly, "I'm here. Keep your eyes on me. Just keep breathing." In the colored ward, we worked with what we had, and we worked harder because we had to. The nurses there, especially the black nurses, carried themselves with the kind of controlled fire, professional, precise, unbreakable on the outside, because the world demanded it. They had to be twice as careful, twice as competent, twice as calm, because any mistake wouldn't be treated as a mistake. it would be treated as proof. And I watched them do excellence without applause. I watched one nurse, Lila, handle a complicated dressing change with hands so steady you could have balanced a coin on her wrist. She didn't talk much, but when she did, it was direct. She said to me once, "We don't get extra chances, so we don't waste the ones we have." That sentence stayed in my chest. I wish I could tell you I marched into the administrator's office and changed everything in a day. I didn't. Truth is, courage isn't always dramatic. Sometimes it's quiet. Sometimes it's strategic. Sometimes it's choosing what you're willing to risk and what you're not willing to become. I was a nurse. I wasn't rich. I wasn't powerful. I could be replaced by Monday, but I could still choose integrity in small ways, over and over, until small ways became a pattern. So I started doing what nurses do best. I noticed. I documented. I pushed when I could. I bent rules when it protected someone. I brought supplies by accident. I swapped out worn tubing for better tubing when no one was watching. I made sure the sickest patients got seen faster than procedure wanted. I used my voice in that careful tone administrators respected, polite enough to be tolerated, firm enough to land. And when a doctor dismissed the ward as fine, I learned to answer with facts, vitals, trends, symptoms, outcomes. Because you can ignore a complaint. You can't ignore a chart that proves you're wrong. At least, not as easily. There was a day that tested me. A little girl came in with a high fever and labored breathing. Pneumonia, likely. Her mother was exhausted and scared, and trying to keep her face calm so her child wouldn't panic. The girl's lips had that faint blue tinge I hated seeing, the kind that tells you oxygen is losing the fight. I asked for an X-ray. I asked for antibiotics. The delay came like it always did, slow, bureaucratic, cruel. Not urgent, someone said. Not urgent. I looked at the child struggling to breathe and felt something in me snap clean. I walked straight to the doctor, straight, not timid. And I said, "She's deteriorating. If we wait, we'll be treating a crisis instead of preventing one." He stared at me like I'd forgotten my place. And for a second, I thought, this is it. This is where they punish you. But I didn't look away, because the truth is, when you're standing between a child and the edge of a cliff, politeness becomes a sin. He exhaled sharp and ordered what I'd requested. We got the medication in. We got her breathing supported. We got ahead of it. Later, her mother grabbed my hand with both of hers and whispered, "Thank you." Not loudly, not theatrically, like she was afraid gratitude itself might cause trouble. I went into the supply room after that and let myself shake for a minute. That's what people don't understand about those years. It wasn't only the patients living under pressure, it was the staff too. Nurses navigating a system where doing the right thing could cost you your job, your reputation, your safety. Especially the black nurses. They carried the heaviest load with the least protection, and still they showed up. Still they stayed professional. Still they cared for people who were treated as second class by the very institution meant to heal them. Over time, I started to see the real divide clearly. It wasn't just black and white. It was truth and comfort. It was conscience and compliance. It was whether you were willing to let the system shape you into someone you couldn't respect. I wasn't naive. I knew I couldn't fix Jim Crow with a stethoscope, but I also knew this. Every day I put on that uniform, I was choosing what kind of nurse I would be, what kind of human I would be. And I decided that if the world insisted on lines, I would spend my life quietly crossing them whenever a life depended on it. Because nursing, real nursing, isn't just procedures. It's advocacy. It's courage. It's refusing to let normal become your moral excuse. My name is Annie, and in that hospital, in that era, I learned something sharp and permanent. A clean floor doesn't mean a clean conscience, and a system can be sick even when the walls are spotless. So, I kept my hands steady. I kept my eyes open. I kept my voice ready. And when the world tried to make care unequal, I did everything I could, small and relentless, to make it human again. Thank you for listening to Annie's story. What you just heard isn't old history tucked safely in the past. It's a reminder of what nursing has always had to be. Courage inside systems that don't always deserve it. The names and signs may have changed since the 1950s, but the core lesson still stands. Care should never be divided by comfort, status, or silence. If this story made you feel something, good. Let it make you clearer. Let it sharpen your standards. Let it remind you why your voice matters when someone is being overlooked. This is Nurse Lounge Café, where we tell the truth, honor the profession, and keep the human at the center. If you want more stories like this, hit subscribe. Drop a comment with the word Annie if you want the next chapter, and share this video with someone who needs to hear it. Until next time, stay steady, stay sharp, and keep your care human. We'll see you soon at Nurse Lounge Café.